So one of the procedures that we do here in the office is called an epidural steroid injection. This is mainly to treat back pain and leg pain. This pain that you get that is called sciatic pain or radicular pain. People that get pain across their back that shoots down into their leg. And when they bend, when they lift, it aggravates that pain. So this is a procedure that we do for that. And the reason we do it is because in the spine, you have these little tiny structures between the vertebrae bones that are called discs. They're like a shock absorber, like a cushion. And those discs over time start to wear and they start to swell and bulge. And people can get bulges where the discs swell and push back on these tiny little nerves that make up these five together, come together and form what's called our sciatic nerve. So if you've got pressure on the nerve in your back, it'll cause pain in your back, but also pain down your leg. So we do a procedure called an epidural steroid injection. We're putting steroid medicine into the space where the disc is. And basically what we're doing, we're taking an x-ray machine. The patient's laying on their stomach. We're using an x-ray machine to visualize the bony anatomy. And then we guide a needle down into the space where the disc is. And so there's a ligament at the very end of this space here. Once we get through that ligament, we're in an open space and we inject steroids right on the space where the disc and the nerve is. And if we can get that steroid on the disc and on the nerve, it'll take pressure off the nerve by decreasing the swelling in the disc. It's very effective for sciatic pain, for disc bulges, disc herniations, and even for degenerative disc disease. So we're going to go now. A patient has given us permission to video, and we're going to show you exactly what happens when you have an epidural steroid injection. Okay, we're set up here for the epidural steroid injection. This is of the lumbar spine. We have the patient exposed, the area where we're going to do here. This is the fluoroscope, which is the live x-ray machine, which lets us see the image. Toby will show you on the screen here. We're looking at the lumbar spine, like the model I just showed you. We're trying to go into this space right here. We go into the space where the most narrowing is, and in her case, that's the space. So she's been anesthetized here by Zach. Thank you, Zach. She's asleep. We can do this without hurting her. We've got a spinal needle that we're going to use. So what I first do is I lay this needle down on the skin. We have Jennifer shoot an x-ray for us. We shoot this image, and so we can see the tip of the needle right about where we want to go there. So I'm going to go just below that, and I'm going to numb up her skin. So we use a local anesthetic, and we numb up the skin. Just do a little stick there, put some anesthetic right under the skin, and then goes a little deeper. And inject down into the tissue so that area will be anesthetized. Now, we'll take the spinal needle. I'm going to lay it back down on the skin where I did the anesthesia. Jennifer will shoot it. We'll see where we want to be there. And then what I do is I take that needle and I'm just going straight down. I'm using my left hand to hold the tip of the needle here so that I don't advance too far. I can just advance millimeter by millimeter and guide it with this hand. And I'm going through muscle. I've done enough of these where I can tell by feel what's muscle. And then once I get down to the space where I want to be, I'll feel resistance. That's either going to be the ligament, which is what I'm feeling right there. And we'll shoot an image of the x-ray and see my needle's going right where I want it to be. Now, once I get to the ligament, I'm going to use a technique called the loss of resistance technique. This is the syringe. It's a glass syringe. There's nothing in it, just air inside of it. I'm going to put about 3 or 4 cc's of air, and I'm going to put it on the syringe and lock it down. Now, if I'm in ligament and that needle's stuck in the ligament, when I push on it, I'm going to get resistance. So I'll keep gradually pushing the needle down, just millimeter by millimeter, and pushing on this until I puncture through the end of that ligament, and now I've lost resistance. So that tells me I'm in the space called the epidural space, which is where we want to be. Now, one way we confirm that is we look and see if there's nothing coming back, we're epidural. I'm going to put some contrast dye in. I'm going to put the dye on, I'm going to put it in, and we'll shoot an image with the x-ray. And here we can see the dye. We can see it flowing down nerve roots. We see little spots in the dye, which is epidural fat. That's another way we know we're in the epidural space. Then what we're going to do is take the anesthetic and the steroid. We just put it right on the syringe, on the needle, infiltrate that in. And then if we look at the image here, we can see that will have spread this out. So you can see it's basically gone now because it spread it all out when the medicine went in. I'll take this off. I'll pull back just a little bit to get out of the epidural space. And then we use saline to inject as we pull the needle out to avoid getting any steroid back to the skin. And then we come out and we're just going to wipe that area off and put a Band-Aid on. She's going to wake up here very quickly. We will take her back to her room. We keep her for about 15 minutes and then off she goes and she's ready to go. These procedures are done with anesthesia or without, depending on the patient's preference. If they want to do it with anesthesia, we have them nothing to eat or drink from midnight the night before, and we keep them about 15 minutes afterwards, and they're off. I ask them the day we do it to kind of be a couch potato and rest, go back to normal routine the next day. We check them back in a week or two and see how it's done. We'll get them started on some lumbar strengthening exercises, core strengthening exercises, and then we'll go from there depending on how they've done with the procedure. But that, simple as can be, epidural steroid injection. It doesn't take long. You're in and out quick. Do those right here in the office. At Focus Health Solutions,